Today I'm going to be talking about meditation and nursing burnout. In the United States alone, there are 3.9 million professionally active nurses, including registered nurses and licensed practical nurses. This makes up about only 1% of the entire United States population, and this 1% is expected to save the lives of the other 99%. According to the World Health Organization, there are approximately 19.3 million nurses and midwives registered in the world. There are only 19.3 million nurses in the world to take care of the population of 7 billion people. Nurses all over the world are held to extremely high standards, and a lot is expected from them. They are the largest component of any hospital staff, and oftentimes are the only ones who will associate with the patients. The biggest problem seen in nursing is burnout that most nurses experience. It's noticed as a type of condition that comes from helping professions like nursing and doctors, and where they become exhausted and stressed to the point of not being able to cope with anything. There's no current operational definition for burnout, but it's typically easy to suspect. And I have a video to help explain more of what nursing burnout is.
Nurses often see themselves as invincible givers, feeling that they must be able to give themselves completely to their patients without showing any signs of stress, fatigue, or depression. Nurses are awesome, but we have to deal with a lot of things, from the good to the real ugly, from taking care of a difficult patient to silencing the boisterous IV machine, to sicking a patient to negotiating with doctors. We do it all, or it seems like we can do it all, but that's not always the case. Nursing is a stressful job, and sometimes we get too stressed. Prolonged stress can cause burnout, but burnout is not just stress. A stress is situation.
Burnout is an emotional condition marked by tiredness, loss of interest, or frustration that interferes with job performance as a result of prolonged stress. It's also defined as mental or physical energy depletion after a period of chronic unrelieved job stress.
Situational, and burnout lasts and lasts and lasts. Nursing has an asymmetrical relationship. It's a job where we give, and the patients take, and take. So it's not we're weak or incompetent. Anyone can experience burnout. Although it's very similar to depression, fatigue, or anxiety, it's actually a whole different bundle. Burnout is characterized by 1. Emotional exhaustion. Much like how a car runs out of gas, nurses can run out of emotions. Depersonalization. Being overtly cynical and detached. Reduced personal accomplishment, which is negative feelings about oneself or the lack of enthusiasm. But all these things.
So basically, nurses have so much pressure put on them that they often take every case personally, and becomes hard to set aside a personal life because they take their work home with them. So it's really hard for nurses to ever de-stress. Burnout is just constant frustration and sometimes even guilt. So losing a patient or making the wrong call on something can really affect a person. So before I go on to try and say what might help prevent this burnout, I'm going to talk a little bit about the education to just show really how important burnout is and how relevant it is. Typically, nurses spend at least 4 years in an undergraduate program, while some only get their associates and spend 2 years. But it's very common to go back to school for some kind of master's or doctoral degree. So nurses are constantly learning, and their education never ends. They're made to be generalists, and they need to be able to take on so many different roles, from acute care to chronic care, or from pediatric nursing to travel nursing. The 4 years most nurses go to school for have to prepare them for a number of different positions they'll be able to hold. So as stated before, there's a lot expected of nurses. And even here at EKU, we have a class that took a portion of its time to focus on how to beat the burnout and how to separate work life from a personal life. And it just shows how serious burnout is. Nurses are educated to the point where they should last in this profession until they retire, and that can be a lot of stress on anyone. It takes a compassionate, caring, and hardworking person to take on a nursing role, and the stress of the job can really affect a person. In a survey done by Carol Isaac, Matt Cusick, and Pitleen Minnick, 2 of the main reasons nurses left their profession were emotional distress and fatigue or exhaustion. The nurses described being on the brink of burnout constantly because they cared too much and pushed themselves to every limit possible. They were bone tired, they were always exhausted. One of the nurses they interviewed stated, "You are always on, thinking and working. It takes hours, sometimes days, to relax after a particular bad day." The problem is that society relies so heavily on such few people, and they aren't able to constantly handle the push and pull of the workforce that they're in. Nurses typically work 4 12-hour days a week, which are consistently busy. There's a need for change if the world expects nurses to be able to last and be able to have the compassion that they always do. Although nurses could benefit from any type of meditation, if they practiced it regularly, loving kindness meditation, LKM, or metta meditation would be an asset and most beneficial to preventing nurses from burning out so quickly or even burning out entirely. LKM is most known for creating feelings of warmth and positive feelings towards oneself along with others. They develop positive feelings in a broader spectrum and also feel more positively towards themselves. Loving kindness and compassion are things nurses already exhibit, and it's common for them to naturally have these feelings radiating from themselves. However, with burnout, it's hard to continue these emotions because you become so drained of everything. LKM is a way to train the mind to help with certain emotional states and change one's happiness. There are studies that have been done to show that LKM leads to more positive feelings, which can improve health, happiness, the mind, and so many other thoughts and emotions. Positive emotions have been shown to help people live longer, have better success, and increase their health overall. Being a more positive person leads to better developments with others in certain relationships and helps a person develop a more positive life. Not only can LKM lead to a more positive life, but it can help nurses with their critical thinking, which is a large component of being a good nurse. LKM helps build people up build up their certain resources, like their cognitive skills, their psychological abilities, social and physical abilities. With these stronger abilities, people are better able to take on life's challenges and take opportunities to better their lives. LKM is able to influence a person's life in a positive way, and if we introduce this into the health field, specifically for nurses, they would have more positive emotions and feel better not only about themselves, but about others. LKM would positively influence nurses, allowing them to feel better about their decisions and allow them to have that time to reflect on their decisions and be able to love themselves. LKM is often paired with compassion mindfulness because both are so closely related. They both try to enhance one's positive feelings while decreasing any negative emotions. Since they're both so closely related, and each one complements the other, if both are used, the results would certainly reflect positively. Happiness, as shown in one study, can actually make a person happier, and LKM and CM focus on making a person happier and have more positive emotions. Compassion and happiness protect us from illness. It's more of a vaccine than it is a cure. So if we were able to start implementing these practices while students were still in school for nursing, it would make a huge difference. Compassion leads to higher brain activity and happiness, and loving kindness can improve mental health, and both LKM and CM improve the well-being of people overall. We're able to see how much simple meditation practices like LKM and CM can physically and mentally make people happier and more positive. These two meditation methods combined can make such a difference on a person's life that they'll actually become healthier individuals, which relates to the next article. In one article by Ellen Burks, she states that healthcare professionals are recommending different types of meditation to help with pain and stress management, depression, anxiety, and even overall health. It is already being recommended that healthcare providers begin practicing meditation as a way to be more present with clients. Based on the widespread use of meditation in healthcare, there is growth interest on the part of healthcare providers to gain increased understanding of different meditation processes. Birx focuses on the two broad types of meditation, centering and opening. Both LKM and CM are centering types of meditation, and the main consequences of centering that Birx points out is less stress. The meditator will feel more whole and more balanced as an individual. LKM and CM can be shown again to actually improve one's health in so many different ways. Both types of meditation will greatly improve a nurse's health to not only help prevent burnout, but to also improve their sense of wholeness and balance in life with themselves and with others. So, the solution to help prevent this burnout, because it isn't a cure, it is a preventative cause. Professionals in the health field should begin practicing LKM and CM, specifically nurses. RNs and LPNs will both benefit from these meditation practices no matter what department or areas that they work in. These practices should begin before a person even begins their career as an RN. So once a student enters a nursing program, they should begin meditation because they're not cures. They can only prevent certain consequences. The sooner these practices are implemented, the better health people will be able to see in nurses. Implementing these practices will help prevent burnout in the nursing community and also improve the wellness and health of so many human beings. Teaching LKM and CM to nurses will also help spread meditation in the community. So many people take advice from nurses daily and do what they'll say will help their health. So if we show nurses how helpful mindfulness to their overall health is, they'll be able to spread the word.